So welcome back to this NPTEL course on Introduction to Exercise Physiology and Sports Performance, part 2 of this module on adaptations to aerobic and anaerobic training. With you, I am Wing Commander Dr. Chandrasekhar Guru. I am a sports medicine specialist in Armed Forces Medical Services. So in this module, we will be learning about the aerobic and anaerobic capacity. What are the adaptations that happens with respect to aerobic and anaerobic training methods? What are the factors that influence this adaptation and various use case scenarios? So we are in the process of understanding various adaptations that happens in because of aerobic training. So to revise briefly, we discussed about exercise training types, aerobic and anaerobic. We saw various systems get undergo adaptations because of these training methods. We saw in detail about the cardiovascular adaptations in terms of increase in the heart size, increase in the stroke volume, decrease in the heart rate, cardiac output, blood flow and the blood pressure response to these adaptations. We also saw the adaptations that happens in the respiratory system and how it is not a limiting factor in aerobic capacity. So having covered till now about various adaptations, so let's now focus on the remaining adaptations that happens because of aerobic training. So what are the muscular adaptations that happens which because aerobic capacity of the muscle increases with training. So that happens because of changes in the muscle fiber type, changes in the mitochondrial function within the muscle, as well as the changes that happens in the oxidative enzymes. We saw that aerobic training it targets the aerobic pathway of the bioenergetics, right? So these are the changes that happens in the muscle because of the aerobic capacity improves. So with respect to the muscle fiber type, you have more of increase in the oxidative muscle fiber type. So we would have dealt in detail about the skeletal muscle physiology and the types of muscle fibers in skeletal muscle module, and we have seen that type 1 and type 2 are two broad categories of muscle fibers. Type 1 is more of oxidative type of muscle fibers and type 2 is more of the glycolytic type of and their fast response. So if you have an activity which requires fast response, anaerobic pathway, and immediately you will have to get recruited, then type 2 muscle fibers get recruited. If the activity is involving a long duration oxidative type of energy system, then your type 1 group of muscle fibers get recruited, right? So the change that happens because of training method is that you will have increase in the type 1 muscles that gets recruited during the physical activity. So the transition or the recruitment of that type of muscle fiber is from type 1 followed by the type 2A and type 2X. These are two different sub transition type that is available in type 2, which is found in various studies that within the type 2 only you have the certain composition based on the training methods. So the distribution of type 1 and type 2 is predetermined genetically. That's what studies have shown. And within type 2 you have certain muscle fibers that undergo transition, that they can be more towards anaerobic or more towards aerobic depending on the type of training that you impart. So this transition from type 2X, which is more of a glycolytic group of muscle fibers, to type 2A, which is more of an oxidative group. So that transition happens because of the aerobic training, and the type 1 fiber size also increases. Not only there is transition within the type 2 level and increase in the recruitment of type 1, you also have there is a hypertrophy of the type 1 group of muscle fibers. They say it increases up to 25% because of the aerobic training. And within the type muscle fiber itself, you have increase in the myoglobin content and the capillary supply, which again aids in better oxygen supply to the muscle fiber. What happens in the mitochondria? So there is increase in the number as well as the size. So both this increase in the number of mitochondria that is available in the muscle, and because of which you will have better mitochondrial turnover. So mitochondrial turnover is also high. So mitochondria functions at its best when the quality is good. So that the younger mitochondria have better capacity and they can perform better. So the older mitochondria which are aged also get kind of regenerated, or they are kind of the turnover, what you call the um, with the composition of the newer and the older is balanced, and it's better in fact because of aerobic training. What happens with the oxidative enzymes? In the oxidative enzymes, you will have increase in the mitochondrial oxidative enzymes. So thereby you have a better energy, generation. ATP generation is better because of the electron transport chain. So we have seen in bioenergetics that electron transport chain happens within the mitochondria, within the gap between the inner and the outer layers of the mitochondria, right? So the enzymes that uh, promotes or involved in the oxidative metabolism or the electron transfer chain, that is enhanced. So because of which you will have more energy production. Also, the source of energy also changes uh, predominantly from fat during the submaximal stage of the endurance activity. So that also involves a lot of increase in the enzyme activity of the fat oxidation enzymes. So that again causes increasing in the utilization of fat as a energy source. So when fat is being utilized as energy source, you have sparing the glycogen which is there in the muscle. So this glycogen can is spared, because of which they can be later utilized when in need to give immediate source of ATPs, right. So we know glycogen can undergo either an anaerobic glycolytic pathway or an aerobic glycolytic pathway depending on the demand. So when the demand is very high, you need immediate energy requirement, and then your glycogen which is stored in the muscle can enter into a anaerobic pathway, right. So that can happen only if you have glycogen. So if the energy source is more from the fat, so you are keeping the glycogen intact. So because of which what happens is this glycogen is available at a later stage of the race in competitive athletes to give generate energy. So that's the glycogen sparing effect of the utilization of fat. That is possible because of the changes that happens in the oxidative enzymes because of the aerobic training. So let's see a case scenario. Rocky, she is an endurance athlete. She used to perform at a pace of say 6 minutes every kilometer. So she covers each kilometer at 6 minutes pace earlier. But with 6 months of training, what she has found that she could improve it to 4 minutes per kilometer. So now when she was earlier covering each kilometer at 6 minutes, now she is able to do it at 4 minutes. So that means she has improved her efficiency and the aerobic capacity, right, during the last 3 kilometer of an half marathon. But then the question here is, what is the reason for the improvement in a race pace towards the end? So with 6 months of endurance training, adaptations has happened in the cardiovascular system, which we saw in the previous part, wherein there is increase in the VO2 max. So oxygen consumption the individual can have is improved to a great extent. And also there is changes that has happened in the muscular adaptation has happened, wherein you have increase in the oxidative capacity in the muscle fibers, because of which fat is predominantly utilized and there is a glycogen sparing effect, and this glycogen is now available for use during the last few kilometers when the pace has to increase to reach to the final end point, right. So that particular thing has helped the individual to increase the pace towards the last 3 kilometers. Further, because of the muscular adaptations, that has resulted in increase in the capillaries to fiber ratio. So that has caused a better oxygen supply to the exercising muscle and better oxygen diffusion. So and it is also seen that the lactate clearance is also better in these individuals because of aerobic training. So the lactate threshold at which there is a steep increase in the accumulation of lactate is prolonged. So that gets also shifted towards the right. So that particular thing also helps in better performance towards the end. So having seen about lactate threshold, let's move on to the adaptations that has happened in the metabolic pathway. So because of the aerobic training, we will have certain metabolic adaptations that happens, and they are broadly in aerobic capacity can be discussed under three metabolic adaptations in the assessment. So, that is the lactate threshold, the other one is the respiratory exchange ratio, and the third one is the maximum oxygen consumption. So, maximum oxygen consumption we have been discussing since beginning. Let us focus on lactate threshold. So, lactate threshold we had discussed in the module on cardiovascular system and exercise. So, lactate thresholds increases towards the right. So, just to recapitulate, so when you ask an individual to perform a maximal exercise and plot the lactate, blood lactate every 2 to 3 minutes while doing the activity in a graph. So, along the x-axis you will have the duration of or the intensity of the exercise, and along the y-axis is your the level of the blood lactate. So, when you plot it, the blood lactate gradually increases with the increase in the grade of the exercise, right. So, at a certain point you will find that there is a disproportionate increase in the rise, sudden steep rise in the accumulation of lactate within the body, so in the blood. So, because of which that is the point when there is disproportionate increase in the lactate. So, what normally happens when lactate is there in the blood, the lactate is shuttled to the other muscle fiber or to the heart and that get utilized. Whereas now why lactate is formed? While lactate is formed because of the anaerobic pathway, the glycogen is broken down, enters the anaerobic pathway, finally it leads into formation of lactate to give you ATP, right. So, ATP is utilized for the activity and the lactate is kind of used for as an energy source in the some other muscle fiber or at the heart. However, when the production is so high, the clearance is not able to match it, because of which there is a increase in the disproportionate increase in the blood lactate, right. So, when we are able to shift this point to a right, that means with the next grade of exercise you are shifting it, you will find that the individual is not getting fatigued or not getting exhausted because of this particular point of lactate threshold. So, the lactate threshold is getting from the point at which the individual will start getting fatigued is prolonged. So, that is the shifting of lactate threshold towards the right. So, that is again an important assessment method by which you can understand whether your aerobic method is functioning or getting the proper response in the individual or not. Okay. So, what is respiratory exchange ratio? Respiratory exchange ratio is nothing but the ratio between the carbon dioxide that is produced by the body and released outside to the oxygen that is consumed. So, it is the ratio between carbon dioxide that is measured at the level of your uh, at the level of your nose and the mouth using a mask when you are testing for a cardiopulmonary exercise testing, and that measures the carbon dioxide that is coming out and the oxygen that is being consumed. So, the ratio that gives you the respiratory exchange ratio. So, this is an indirect measure of what has happened at the level of cellular level. So, generally that gives you the rough indication of what is the predominant fuel that is being used. So, not going into much detail, if the ratio is low, you can know that it is because of more utilization of fat. So, when fat is utilized as a predominant energy source, the ratio is less than 1. When the ratio is more than 1.1 or so, you mean you can indirectly understand that predominantly it is the glycogen or the carbohydrate that is being used as the source. So, here when your respiratory exchange ratio is lower, that means that fat is being used. What we discussed earlier, so because of the changes that has happened in the muscle, the oxidative capacity to use fat has improved, right. So, because of which you will have more predominant use of fat. So, when you use RER as a method, you will find that with training gradually the RER which used would have been 1 can gradually come down up to 0.9 or 0.8 as well during a submaximal exercise activity. However, in the same individual with increase in the pace, the individual will end up in using more of glycogen. So, obviously the RER will increase towards the end. So, that is how you interpret RER. And VO2 max we have discussed a lot. It increases with endurance training. 15 to 20% increase is there, which is generally seen over 6 months of training. So, an individual who has not been exposed to any sport starts an aerobic method of training. 6 months you will find some increase of about 15 to 20%. So this peaks at about 6 to 12 months of training. However, with age, after a certain point of training, the amount of VO2 max that the individual has reached gets static, doesn't improve much. However, the assessment can be done based on the lactic threshold method to see whether how much is the improvement in the aerobic training that has happened. So let's also cover about the endocrine and the neural adaptation that happens because of the endurance training. Because of endurance training, you have increase in the hormonal levels as well as the receptors. So both the hormones and the receptors increase because of the training, and you have increased this particular kind of increased level can be enhanced by high intensity training as compared to a high volume training. So with high intensity training, you will have better hormonal adaptations. What are the neural adaptations that happens? Initially, during the initial phase of training, it is predominantly the neural adaptation that happens, which gradually improves, and this particular neural adaptation contributes to the efficiency of the movement. Say in a runner, the neural adaptation helps in better running style, and by which the economy improves. So with the limited kind of movement, you are saving more energy, so by which your economy improves and the oxygen consumption also is accordingly modified. So that's how neural adaptation helps in improving the aerobic performance. What about body composition? In case of body composition, you will have reduction in the fat percent. One is because of increase in the fat utilization as a source, and generally it's because of the increased volume of training. So in aerobic training, if the volume is predominantly concentrated, then you will have more of a catabolic state wherein the catabolic hormones are released, and that also can increase in the mobilization of the fat. So a certain amount of period or the duration is a critical factor if you want to use to mobilize the fat as a fuel. So generally the intensity is moderate, so 55 to 70 percentage of your VO2 max is the intensity. The volume is generally beyond 40 minutes, so that is when you will have predominant use of fat. With training, this kind of the duration and the thing that is required to activate the mobilized fat also changes. When you consider the fat free mass, that is the lean body mass, there's not much of change that happens with respect to the lean body mass because of aerobic training. As the fat percentage decreases, you will also find the body weight dipping down. Training parameters in terms of exercise parameters, in terms of the frequency or intensity type and the timing of the activity. So the two important factors in aerobic adaptations to take place is that volume and intensity. So with respect to intensity, when you have the parameter which determines a better aerobic power is because of variation in the intensity. When you increase the intensity, short duration, vigorous intensity sessions in your program, you will have better improvement in terms of the VO2 max. And also the short duration training should include kind of more of high intensity sprints with reduced rest, and that is also found to increase the VO2 max. So if you are a trainer, in addition to giving high volume training during the microcycle, certain sessions which have short duration, high intensity activity with less amount of rest interval between also should be incorporated, so that your VO2 max can have better improvement. With respect to the volume, as we discussed, long duration definitely increases, but then the intensity should be moderate. So if you are going for a prolonged duration, then the intensity should be uh, less. If you have high intensity, then the volume should be low, which we discussed in our exercise training principles. Generally, it is advised by WHO that 150 minutes of moderate intensity per week will help you to maintain the general cardiorespiratory fitness. So again, coming back to the question, what limits the capacity and performance of aerobic methods? So there are two different theories that have been hypothesized for this particular reason. What is the thing that limits the aerobic capacity? So, one is the utilization theory. The utilization theory is that because of inadequate mitochondrial enzymes, the oxygen, the muscle is not able to extract the oxygen that is required for the particular physical activity or the aerobic activity, and that is the reason that limits the aerobic capacity of that individual, because oxygen is not available. Whereas the other theory is that the cardiovascular limitation, wherein the muscle is able to extract, however the cardiovascular system is not able to provide the oxygen or deliver the oxygen to the muscle. So this is the other theory. However, now with a lot of evidence emerging, most of the studies are pointing towards the cardiovascular limitation theory, wherein it is the inability or inadequate supply of the cardiovascular system to deliver oxygen to the exercise muscle. So that would be a reason why that limits the aerobic capacity in an individual. So let's focus on certain factors that determine the aerobic adaptations. The first one is the heredity or genetics. So we discussed about this in our previous module as well. The nature versus the nurture theory, right? So most of the times it is all predetermined genetically. So in these individuals, the upper limit is already predetermined. So you cannot go beyond that upper limit. However, the scope of reaching that upper limit. So that's how training method helps you to reach that upper limit, right? So this particular influence is about 25 to 50% in terms of the aerobic capacity. And what about the variations with respect to male and female, or with respect to the age? With age, the aerobic capacity drops because of the aging factor, wherein there is increase in the fat and decrease in the muscle mass. So we know that muscle is the one which is responsible to consume oxygen, right? So when the muscle mass reduces, obviously you will have a decrease in the VO2 max. So that's the reason with age the VO2 max decreases. When you see between men and female, men and women, so the men have obviously have better VO2 max. That's because of their physiological composition. Again, there's more fat in women because of the gender related requirements, and lower muscle mass. So that is again is a reason for more kind of better VO2 max in males, and relatively lesser VO2 max in female. The other factors are the individual variation. So you, within a group of people, you will have a lot of individual variations with the concept of low responders and high responders. So even studies done conducted in twins, it is seen that there are variations between the twins as well. So that's because of the individual variations that is there within the individual. So as a trainer, or as a sports scientist, or as a exercise professional, it is important to note that though we have a generic program generally, it is important to identify the low responder group and the high responder group, and tweak the training program, so that accordingly you will have the better outcome. The other important factor that can influence is your altitude. Why altitude? Because as the altitude increases, the ambient oxygen pressure, partial pressure decreases. So that again has various physiological changes happening. So this is again covered in exercise in altitude module by Colonel Hanup. And we know that the hemoglobin level increases, the ventilatory and the diffusion capacity in the lungs also increases because of the altitude, and it also causes a better buffering capacity by maintaining the acid base balance, and increases the capillarization. So this is also utilized in terms of training the athletes. So certain, you will find world class athletes training at regions that are at higher altitude, so that these changes can be stimulated in the body, and because of which the performance when they come back to the plane or at the lower altitude is better. because of the adaptations that has happened in the cardiovascular system. So that's an important point that we need to remember about altitude. The other important factor is the doping as well. So the other artificial way of kind of improving the oxygen delivery is by one of the method called as blood doping. So it is a banned method by World Anti-Doping Agency, wherein artificially you increase the RBC level in the blood by infusing the own blood cells or also the artificial blood cells, or using any other artificial means to increase the blood cells by using erythropoietin. So these are banned ways by which also the aerobic adaptations which happens because of training can improve. So that's why they are banned. So let's discuss a case. Lalan is a novice boxer. Okay, so he started training since last 2 years, 12 weeks, and his coach found him to get fatigued sooner than his counterparts. And what do you think, as a coach, he has to work to prevent his fatigability, because he's getting fatigued faster than the other people? And what is the effect of fatigue on performance? What's your take? So boxing, even though it is a more of a sports which require more of muscle endurance, cardiorespiratory fitness is key. Why? Because you have multiple ports and multiple matches within a day. So there you need faster replenishment and you want to perform better in each boat. So cardiorespiratory fitness is a key motor quality that needs to be developed in a boxer. So in this case, Lalan must have undergone some pre-participation medical, and he is so if the pre-participation medical was normal and then he has started training, so over 12 weeks training, if he is getting fatigued, then probably because of not much of adaptations that is happening in the aerobic capacity, the cardiorespiratory fitness. So in such cases you will have minor fatigue that can creep in, which can result in decreasing the performance. It can also increase the reaction time as well as the movement times. So boxing being a very important key sport with respect to your footwork, the reaction time and the movement, and as well as the kind of the time speed at which you are able to give a punch. So these all are also affected if your cardiorespiratory fitness is poor, because everything requires blood to be supplied where oxygen is taken, and that needs to replenish the immediate stores, right? So that decreases your performance as such. Also your agility and neuromuscular coordination also dips. Moreover, since the blood supply to the brain also may be compromised, so you will have decrease in the alertness as well as the concentration. So overall there is a dip in the performance if your cardiorespiratory fitness is poor. So hence cardiorespiratory fitness is an essential component in case of non-endurance sports performance as well. So this is another case where Ruby is a long distance runner. She has been training since last 3 years. Okay, and a coach found her getting fatigue sooner than a previous training session. So in this case, same fatigue is there, but then she's been trained since last 3 years. So recently this lady, she's not able to she's getting fatigued faster. A coach finds that performance has also dropped, so there is also performance drop because of the early fatigue. And what would be the reason for fatigability? So these are two different cases of fatigue, where one, it was not of a predominant endurance sports, but then where probably because of poor cardiorespiratory reserve, the individual was getting fatigued. Now here this is a case of a long distance runner who is already being trained in the last almost 3 years. So obviously the cardiorespiratory fitness is better, but of late the individual started developing fatigue, and also performance has dropped. That's what the coach has found during assessment. So what would be the reason? So here this is an endurance activity, and last 3 years the individual has been and fatigue is present. The performance also has shown a dip. So the reasons probably would be because of overtraining syndrome. So when we consider the adaptations, we should also consider the concept of overtraining syndrome. Why? because when training is not properly systematized and given the demand to the body, the adaptations may not happen the way you want. So when in such cases there may be the individual may go into a state called as overtraining syndrome, wherein even though the demands are given, but the response are not as expected to the demands. So that means the body is not responding properly. So that is called as overtraining syndrome. And the other reasons could be lack of adequate nutrition. Nutrition may not be good enough. The individual is probably taking low in calorie as per the demand of the training program. So that would be a reason, or probably the individual is not sleeping properly. Some other health related issue or the mental related issue could be there. So the individual may also be, which is commonly seen in endurance athletes, because of the relative energy deficient syndrome. So this can happen, which also can simulate a overtraining syndrome. So it's important to screen for these important syndromes as a coach or a exercise professional, that you will have to understand. And most common reason would be also maybe a anemia. So anemia is what? Anemia is a condition, medical condition, wherein the hemoglobin levels are lower, and we know that hemoglobin is important for your oxygen delivery for any aerobic activity, right? So when hemoglobin is low, then obviously the performance also will be affected. And also you will have to refer to a physician to check for other clinical condition to examine the reason why the individual has easy fatigability. So in the same case, coach finds that performance drift, how would you proceed further? So we discussed about the reason probably. So if you ask me, then I would suggest that to the coach, do a 7 days average heart rate. That will give you an idea, because heart rate is one of the way by which you know that the individual is getting properly adapted or not, right? So that's one thing. Assess the sleep quality. You have to rule out at your end whether the individual is sleeping properly or not. So you can ask the individual to monitor the sleep, the time at which the individual goes to bed, and how long the individual takes time to fall asleep after laying on the bed, and when the individual gets up the next day morning, how is the quality of the sleep, or how the individual feels after getting up, waking up from the bed. Or you also should ask the individual to monitor how many times the individual had a break in the sleep, probably because of going to washroom or some other reason. So those things have to be monitored and kept for at least 1 to 2 weeks. So that gives you a pretty good idea about the nature of the sleep, if sleep is disturbed or not. Then you also need to know what's the diet composition of the individual. So you already have framed a training program. Ask the individual to note down or record the activity, as well as the record the diet that the individual is taking over 7 days. So that gives an idea how much is the intake and the output. Also screen for relative energy deficiency syndrome, more common in female, because of the menstrual as well as the other related issues as well. So the common triad, initially earlier it was termed as female athlete triad. Now it's been recent evidences have shown that the condition is also common or seen in males as well. So it is not only related to female, it is also seen in male. It's probably because of the energy deficiency that happens in the body because of higher training output, whereas the intake is slightly reduced. So that gives rise to various problems in terms of the bone as well as in terms of the menstrual issues. The energy intake has to be addressed. You'll have to also speak with the athlete to know about any menstrual issues that is having that is present in the female. Also the output input output calculation as per the energy that is being consumed, that needs to be taken care. And also check for the other musculoskeletal symptoms to screen for the this particular thing. So even after screening you find nothing abnormal, then I would suggest consult a physician or a healthcare professional of the particular team. If you are a sports if you are into a proper sports setup, assessment for anemia is important. Assessment for other vitamins and micronutrients, common is vitamin B12, vitamin D, These are just generally when they are low in the recommended daily range, then they also affect the performance. Moreover, in case of elite level athletes, when the training program is very exhaustive, there may be relative deficiency that can happen in the micronutrients and vitamins as well. So that needs to be assessed first in order to replenish properly. And the third one is, in case of these individuals who would get continuously trained, because of the monotony and the goal setting and other aspect as well, you will have psychological issues as well. So mental health also needs to be assessed, is a mandatory thing that needs to be assessed. In addition, it's a cardiovascular and the respiratory system which are mainly responsible for your aerobic capacity. So these system also have to be screened for any kind of pathological changes that is hampering the improvement in the particular athlete. So to summarize, we have seen about the aerobic adaptations, or the adaptations in the body to aerobic training. So in this particular part, we covered the muscular adaptations that happens in the mitochondria, the fiber type and the oxidative enzymes. What are the different metabolic adaptations and how we can assess them, the neuroendocrine adaptations as well, how the change in body composition happens because of the aerobic training, and how the parameters of exercise prescription has to be tweaked in order to have better aerobic performance. We also saw about various factors that influence the aerobic adaptations, and we discussed certain case scenarios about the reasons for fatigability, the glycogen sparring, and how we go about in a case which is predominantly endurance with fatigability, and or a case with non-endurance sports with fatigability. So if you want to have further in-depth knowledge about this topic, I would suggest you towards this particular standard textbooks of exercise physiology and sports performance. Thank you.